Lung volume. The most accurate method of measuring lung volume is whole body plethysmography. Like spirometry, it measures the volume of air inhaled and exhaled. However, since the test takes place in a closed box, technicians can determine the volume remaining in the lungs after exhalation, which allows them to calculate total lung capacity, the total space inside your lungs that air can occupy. Whole body plethysmography takes 3 to 5 minutes. You sit in a clear booth and a technician supervises you. Pipes are attached to the booth to measure the pressure inside and are connected to a monitor. You are given a mouthpiece and nose clip and are asked to breathe normally. Then to pant rapidly while the mouthpiece shutter is closed, and then to breathe as deeply as possible, both in and out. Wear loose, comfortable clothing and avoid smoking for 6 hours beforehand. If you use an inhaler, you may have to stop 6 hours before the test. You may be asked to hold your cheeks as you breathe to avoid changes in pressure in the mouth due to blowing the cheeks out. You can open the booth from inside if necessary. Your residual volume is around 2 pints or 1 liter of dead air in your lungs that you cannot exhale. The breathing pattern. This graph shows the pattern of airflow during the test. When you are asked to pant, the mouthpiece shutter is closed. No air flows, but the volume and pressure in your lungs still change. The technicians measure pressure changes in the booth, which allows them to calculate your TLC. Breathing into a mouthpiece. Whole body plethysmography uses a mouthpiece similar to spirometry. The key difference is that you sit inside an airtight booth, which means that volume changes in your lungs can be measured as changes in air pressure within the booth. The test yields several volume figures in addition to TLC. Tidal volume is the amount of air moved during normal breathing. Inspiratory and expiratory reserve volumes are the additional amounts of air moved during forced breathing. The residual volume is the air remaining in the lungs even after maximum expiration. All these measures can be compared to healthy individuals of the same age, ethnicity, sex, and height. This helps diagnose obstructive or restrictive lung disease, or both. Causes of restrictive disease include pulmonary fibrosis and obesity. In obstructive disease, the lungs cannot allow as much air to leave as normal. COPD and asthma are examples. The results show 4 different volume measurements. Each may be of interest, but together they add up to your total lung capacity, or TLC. Thank you for your attention.
Let's now go to pathology. Let's discuss phlegm part 2. Phlegm is a yin pathogenic factor and it injures yang. Phlegm is a pathological accumulation of fluids which occurs when there is a disruption to lung qi diffusing and descending, heart qi moving and transporting, spleen yang transforming and transporting, kidney yang warming, transforming and excreting, and liver qi free flow. The warming movement, transportation, transformation, and excretion of fluids depends on yang qi. Thus, when yang is deficient, yin prevails, fluids accumulate and form phlegm. Conversely, as phlegm is an accumulation of yin, it injures yang. Phlegm is sticky and obstructs the qi mechanism. Because phlegm is sticky, it causes symptoms such as sticky phlegm, sticky mouth, the sticky saliva at the corners of the mouth, nausea, vomiting, phlegm in throat, swallowing and spitting, and mucus in stools. Because it is sticky and obstructs the qi mechanism, phlegm is difficult to remove. Because it becomes chronic and gives rise to the slow pathological changes. Because it obstructs the qi mechanism, very often qi-moving herbs are added to prescriptions that resolve phlegm. Phlegm causes lumps. As phlegm is an accumulation of fluids and it is yin in nature, It may give rise to lumps, swellings, nodules, lumps under skin, lumps in the abdominal cavity or in organs. Lumps deriving from phlegm are generally relatively soft on palpation and usually painless. By contrast, lumps deriving from blood stasis are usually hard on palpation and painful. Many diseases characterized by lumps are due to phlegm. Luoli, scrofula, Yinglu goiter, Pequai, P. masses, Zeng, Zhangna, Zhang, Zengna, abdominal masses, Tanhe, nodules, and Rupi, breast lumps. Phlegm flows and moves, always changing. Phlegm always moves and flows. Flows chi in its ascending or descending and entering and exiting, and it goes round the body on the exterior and to the internal organs. It is stored in the lungs and it is amassed in the stomach. It obstructs the heart orifices. It harasses the liver and gallbladder, and it settles in the channels. Thank you for your attention.
Let us now talk about stomach 17, center of the breasts, located at the center of the nipple. How to find? In men, this is usually located fourth sun lateral to the anterior midline at the level of the fourth intercostal space and is also used for reference. In men, also located on the same level, are REN 17 at the anterior midline, kidney 23, tooth sun lateral to the anterior midline, spleen 18, sixth sun lateral to the midline, pericardium 1 sun lateral to the nipple, GB22 and GB23. In women, the location of the nipples varies considerably and should therefore not be used for reference. Due to its location, needling and moxa are forbidden. No therapy, this point is for reference only. Thank you for your attention.
Okay, so we'll have the last liver pattern, which is the blood deficiency causing liver wind. So why is this? It's because the blood deficiency uh, failing to nourish the sinews and the vessels. So what are the clinical manifestations? We have tremor on the limbs, muscular twitching, numbness of the limbs, dizziness, tinnitus, pale face, withered and brittle nails, pale tongue, thready and so for the analysis, this pattern is chiefly caused by internal diseases, chronic blood deficiency, or acute and chronic blood loss. Now, all of which lead to blood deficiency with failure to nourish the sinews and the vessels. Now, this condition will arise when liver blood, which is an aspect of the liver yin, is too weak to anchor liver wind, which is an aspect of liver yang. And when there is blood deficiency, it is as if blood does not completely fill the vessels. So a vacuum in the vessels arises through which wind can move. Now this is similar to the gusts of wind that blow through underground railway tunnels, where the vacuum created by the train in the tunnel draws in air that then rushes around the tunnels. Similarly, wind can rush around the vessels and channels when there is a vacuum created by the blood deficiency. Okay, so here's another summary. Take a screenshot. And again, this is caused to poor diet, nourishment, or lacking in protein, specifically blood loss, excessive physical work, chronic illness, and too much sexual activity. Um, Underlying pathology is chronic deficiency of liver blood. Now, uh, possible presenting conditions would be fright, wind, or convulsions, especially in children. Now, again, for the signs and symptoms, we also have light menstruation and poor memory, blurred vision as well. For the pulse, we have wiry and fine, tongue would be pale and thin. And for the treatment principle of this pattern is we have to nourish the blood and extinguish the wind. So what are the points that we can use? We use the liver 2 and liver 3 to calm the liver and extinguish the wind. We have spleen 6 to regulate the liver and nourish the blood. We use gallbladder 20 to extinguish exterior wind. Li4, which helps eliminate wind from the face. As Sanjao 5 extinguishes the wind and benefits the head. 219 eliminates the wind, calms the tremors. Ren 4 nourishes blood with moxa. And bladder 20 helps in chronic infantile fright wind or convulsions. Do 20 extinguishes interior wind. Um, Liver 8 nourishes the liver blood. Bladder 18 nourishes the blood. And kidney 3 enriches kidneys to nourish the blood. Lastly, the bladder 17, use it with moxa to help nourish the liver blood. All right, that's it. I hope you had fun.
Common symptoms in internal medicine. Vertigo. Vertigo accompanied by the standing headache, tinnitus, flushed face, inflamed eyes, and a taut and rapid pulse is due to blazing liver fire. If the patient is in a daze as well and the vertigo is further accompanied by chest tightness, severe nausea, and a greasy tongue coating, it is due to phlegm dampness trapped in the interior, preventing the ascent of pure yang. If vertigo is accompanied by weariness, a pallid complexion, a pale tongue, and a depletive pulse, it is due to deficiency of both qi and blood. If accompanied by lumbar and knee aches and weakness, spermaturia and forgetfulness, it is due to deficiency of liver and kidney yin. If accompanied by dry and irritated eyes and the sensation that the head is heavier than the legs, it is due to abnormal ascent of liver yang. Head distension. This is a sensation that the head is being distended. If the distending sensation is associated with pain and accompanied by a bitter taste, a yellow tongue coating, agitation, and irascibility, and a taut and rapid pulse, it is due to flaming upward of liver fire. If it is associated with a sensation of heaviness and accompanied by chest tightness and a greasy tongue, it is due to dampness blocking the interior. Palpitation of the heart. This is commonly seen in conditions that affect the heart, especially deficiency of heart qi, deficiency of heart yang, deficiency of heart blood, and deficiency of heart yin. It is also seen when heart fire blazes or when phlegm blocks the heart openings. In clinical practice, identification of the specific cause of heart palpitation is made on the basis of the accompanying symptoms. If accompanied by weariness and spontaneous sweating, it is due to deficiency of heart qi. If accompanied by cold aversion and cold limbs, it is due to deficiency of heart yang. If accompanied by dizziness, a pale complexion, and a pale tongue, it is due to deficiency of heart blood. If accompanied by recurrent fever, night sweat, a red tongue with little coating, and a thread-like and rapid pulse, it is due to deficiency of heart yin. If accompanied by restlessness, sores in the mouth, a red tongue with yellow coating, it is due to upward flaming of heart fire. If accompanied by mental confusion, chest tightness, and a greasy tongue coating, it is due to phlegm blocking the heart openings. Restlessness, accompanied by sores on the tongue and in the mouth and a red tongue with yellow coating, is due to strong heart fire. Restlessness, accompanied by recurrent fever, night sweat, and a red tongue with little coating, is due to deficiency of heart yin. Chest tightness. This is discomfort from a sensation of blockage or distension inside the chest. If accompanied by coughing, productive of sputum, it is due to impedance of lung qi. If accompanied by palpitation of the heart and chest pain, it is due to blockage by stasis of heart blood. If accompanied by distension of the flank and frequent sighs, it is due to blockage of liver qi. Thank you for your attention.
Let's now go to comprehensive health history. Let's discuss social history, part 3. Drug and alcohol use. For all of the substances addressed in this section, the social conditions of use often play a major role in determining amount and pattern of consumption. Knowledge of the conditions under which and with whom a patient may engage in substance abuse can help the provider to develop more effective interventions. Many patients who engage in substance abuse will abuse more than one substance. Smoking is addressed in this portion of the history because of the addictive properties of cigarettes. If a patient smokes, determine how long, and under which conditions he or she smokes. Example, all the time, only at work or social situations. Also ask who will be exposed to the patient's secondhand smoke. Smoking cessation interventions, however brief, should be carried out at every patient encounter. Inquire about past and current usage of any illicit drugs, such as amphetamines, ecstasy, cocaine, marijuana, heroin, and steroids. Determine the amount, type, method of administration, and perceived impact on health. If the drug administration is by injection and are needles shared, inquire about alcohol intake, noting type, amount, and frequency. Does the patient drink alone? Some subpopulations may be particularly vulnerable to dependence on alcohol. Alcoholism in the elderly is a growing concern of many healthcare providers and is thought to be related to the feelings of loneliness, loss, and decreasing physical and mental ability. If providers suspect alcohol abuse, they can use instruments such as caged questionnaires to further assess the patient's use of alcohol. For social support, how does the patient perceive her or his level of social support? Who or what are the patient's primary sources of support? To what extent does she or he want these individuals or entities to be involved in her or his care? For stress and anger management, ask the patient to identify sources of stress in his or her life and to describe strategies used to cope with stress. Inquire about the patient's anger management strategies. For recreation and travel, which interests or hobbies does the patient have? Does the patient participate regularly in recreational, occupational, or professional or church groups? Note any major travel within the recent past, especially if travel involved potential exposure to untreated water, raw sewage, rodent excrement, contagious disease, and/or parasites. For cultural beliefs and practices, how do cultural beliefs and practices influence the patient's healthcare behaviors? For example, if the patient comfortable performing breast or testicular self-examination, discuss patterns of communication about healthcare information within the family unit. Who makes healthcare decisions? If pertinent, what are the beliefs about death and dying? Does the patient utilize folk medicine and culturally based healing practices? If so, how might these be integrated into the plan of care? Will the clinician have to negotiate modification of some of these practices to achieve treatment goals? For spirituality, what role do spiritual beliefs and practices play in the patient's life? Are they the key source of support for the patient? How can they become a component of the patient's plan of care? And lastly, for military service, note the branch and dates of service, occupational specialty, geographic location of assignments, and any potential exposure to hazardous materials or conditions. Thank you for your attention.
Okay, let's go to emergency for, acupunctures for emergencies. And this time we'll talk about stroke, its etiology and pathology. Let's begin. So, stroke is a condition characterized by sudden loss of unconsciousness, hemiplegia, numbness, dry mouth and tongue, and dysphagia or aphasia. Depending on the extent of injury to the brain or meridians, it may be classified into two kinds, that involving the meridians and that involving the viscera. So let's talk about the etiology and pathology. So stroke develops in the patient when chronic dysfunction of the visceral organs leads to Qi deficiency and blood insufficiency. In this state, a number of processes can result in disordered movement of Qi and blood and give rise to endogenous wind, fire, phlegm, and blood stasis, thereby causing blockage of or extravasation of blood from the cerebral vessel. So these processes include the following: excessive fatigue injuring the interior, melancholic brooding or excessive rage, dietary overindulgence or overtaxing physical activity leading to blood stasis and blockage, internal accumulation of phlegm and heat, yang transforming into wind. Now, in all these cases, cerebral vessel blockage or extravasation of blood can lead to coma and partial or total paralysis. Now, cumulative deficiency of genuine qi. Senescence may reduce yang qi to as low as half of its normal level. Chronic illness with a weak constitution also results in deficiency of both qi and blood. Regardless of its cause, deficient qi loses its motive force for blood circulation, so that blood becomes static and forms clots that block cerebral vessels. Now, immune deficiency, yang become hyperactive so that endogenous wind stirs. Now, this in turn causes qi and blood to move abnormally, carrying phlegm and blood clots to attack the orifices and cause a stroke. Now, for intemperate diet, overindulgence in alcohol or fatty and sweet foods or obesity with impairment of qi actions may impair what? The spleen functions, obviously. Now, spleen dysfunction allows endogenous dampness in phlegm to form and accumulate. Gelling of phlegm transforms into heat and induces the stirring of liver wind. Erratic wind, in turn, attacks upward and disturbs the channels in meridians, causing blockage of the orifices and inducing stroke. Now, injury by passion. Unregulated passions can lead to stagnation of liver qi and blood stasis in the cerebral vessel. Strong rage can injure the liver and cause sudden hyperactivity of liver yang and blazing of heart fire. Wind and fire interact and readily cause qi and blood to move erratically. If this erratic movement of qi and blood disturbs the brain, a stroke may result. For physical exhaustion, this would lead to impaired regulation of yang qi, which may then rise upward and cause wind to stir. Phlegm and static blood move upward, carried by ascending qi and fire, and disturb the upper orifice. This may also cause a stroke. For the exogenous pathogen, deficiency of genuine qi makes the patient highly susceptible to attack by exogenous pathogenic evils. Now, in this state, the exogenous pathogen may induce the stirring of phlegm and dampness or stagnation of qi and blood by direct attack on the meridians. In either case, blockage of cerebral vessels may ensue the ensue and lead to a stroke. Now, the location of a stroke is principally the brain, but the heart, liver, spleen, and kidney are also affected here. Broadly speaking, the pathological mechanism of stroke falls within the following six categories: deficiency of yin or qi, fire of liver or heart, wind of liver or exogenous pathogens, phlegm with wind or fire, qi for abnormal movement, and blood for stagnation. Any of them can interact and influence any other. Interesting, right? Thank you so much for listening.
We discuss heart and gallbladder qi deficiency as a pattern in erectile dysfunction. Clinical manifestations: impotence, premature ejaculation, depression, timidity, sighing, insomnia, palpitations, easily startled, tongue pale, pulse weak. Treatment principle: tonify the heart and gallbladder, lift mood, and calm the mind. Points: heart 7, 5, bladder 15, GB 40, REN 6, DO 20, stomach 36, spleen 6, SI 3, with bladder 62, REN 3, and bladder 34. All are needled with reinforcing method. Heart 7, 5, and bladder 15 tonify the heart, lift mood, and calm the mind. GB 40 strengthens the gallbladder. REN 6 and DO 20 tonify and lift chi and lift the mood. Stomach 36 and spleen 6 tonify chi and blood in general. SI 3 with bladder 62 open and regulate the governing vessel and lift the mood. REN 3 and bladder 34 treat the genital system. Thank you for your attention.